Mesdames, Messieurs les ministres,
Distinguished ministers,
Monsieur le Président du
dear President of the Global Health Program at the Bill and Melinda Gates Foundation,
Mesdames, Messieurs, honorables participants,
ladies and gentlemen,
je voudrais à l'entame de mon allocution
I would like to begin my remarks by thanking the authorities of the Federal Democratic Republic of Ethiopia for the warm welcome that was reserved for me in this beautiful and joyous land of Addis Ababa.
transmettre très solennellement les salutations de son
I would
Excellence
like to extend to you the greetings of His Excellency Mr. Macky Sall, President of the Republic of Senegal.
à la réunion annuelle des grands challenges et
I am
très
honored
important
to
la
represent him at the annual meeting of Great Challenges and very pleased to speak in his name in front of this assembly constituted of celebrated authorities of the continent, leading scientists, as well as technical and financial partners.
africaine
Ladies and gentlemen, the people of Africa have strong aspirations for prosperity and well being. The African Union has fully understood this because its 2063 agenda takes into account the need for inclusive growth and sustainable development.
Je voudrais saluer la grande vision de l'Afrique que nous voulons.
I would like to salute the great vision of the Africa we want. This vision cannot have stronger foundation than science, technology, and innovation.
Incontournable
Indeed, scientific innovation is essential if we are to meet the challenge of creating optimal conditions for the development of our population.
application de nos
Better involvement of our states in the development of scientific research and innovation is recognized by all as an imperative. But we know that such an ambition must be accompanied by the definition and implementation of coherent,
harmonieuses et concertées
harmonious, and concerted actions in an inclusive and multi-sectoral framework.
contre le paludisme est l'exemple d'un modèle d'appropriation
The fight against malaria is an example of a model of ownership with effective collaboration of the public
l'implication de toutes les
and private sectors and the involvement of all social and professional groups.
et ses collègues de l'Union africaine
The head of state and his colleague in the African Union have kindly asked the NEPAD agency to initiate actions to move towards the elimination of vector-borne diseases such as malaria.
dans de nombreux pays la lutte contre le paludisme
In many countries, the fight against malaria has been hampered by the rapid spread of resistance
et aux insectes.
to anti-malarial and commonly used insecticides.
Ainsi, il s'est avéré nécessaire
Thus, it has been necessary to develop new technologies that can be combined with current intervention tools in order to fill the gaps identified.
la manipulation génétique a été suggérée
Genetic manipulation has been suggested as one of the complementary tools presenting new opportunities and having a high impact against the main vectors of malaria. Ladies and gentlemen, dear participants, these efforts are part of a global dynamic that has prevailed in recent years and which has significantly reduced malaria morbidity and mortality in our countries with a considerable economic impact.
cependant pour l'inscrire dans la
However, in order to make it sustainable, reflection and action must be extended as much in strategic and operational planning as in the execution and financing of research and innovation. In Senegal, the President of the Republic, His Excellency Macky Sall, has made research and innovation one of his priorities. This has resulted, among other things, in the creation of a Ministry of Higher Education, Research and Innovation, but also in the setting up of a research department in the ministerial departments.
cela s'est traduit également
This has also resulted in another initiative, the most prominent of which in the health sector are the IRSF and the Institute Pasteur in Dakar.
l'Institut de recherche
The Institute for Health Research in Epidemiological Surveillance and Training, IRSF, led by eminent Professor Suleiman Bo, present here, was launched in 2017. It is located in the new city of Diamdao in a district dedicated to science called City of Knowledge, which plans to host national and international institutions such as the new Franco-Senegalese campus of the Research and Development Institute, the new Amadou Matarbo University of 30,000 students, a media library, a sharing center, the House of Science, and a supercomputer. RSF regroups within it the Regional Reference Laboratory of the African Network for Health Research, the Reference HIV Laboratory of WHO and UNAIDS in West Africa, the Regional Center for Monitoring Resistance to Antiretrovirals, and the Reference Center in Epidemiology. It is a hub of excellence in the field of research on tropical infectious disease that has expertise and a technical platform comparable to those of research institutes in developed countries. On another note, the Institute Pasteur in Dakar has set up the first rapid test manufacturing platform focusing on epidemic diseases with an innovative economic model that allows African countries to access it at 40% of its price. Its collaboration with the Ministry of Health and Social Action is strengthened whenever necessary by deploying a mobile laboratory during the electronic surveillance epidemics based on the Sentinel site, strengthening the information system and the prospect of vaccinopole with the establishment of a vaccine unit. Ladies and gentlemen, our countries have made significant progress in the field of research and innovation. However, several challenges still remain, mainly related to the integration of strategies, the adaptation of trainings to the need of research and innovation, protection of personal data of our citizens, as well as increased mobilization of domestic resources for funding research. To meet these challenges and build a resilient and intelligent society, we need to begin a global and forward-looking approach adapted to the context of the different stakeholders. To do this, our approaches need to move away from geographical and technological boundaries to fit into a multi-sectoral and inclusive framework. This dynamic of mobilizing African intelligence towards the use of innovative technologies to roll back the disease can, as I'm convinced, count on the support of our technical and financial partners. Dear partners, your determination alongside that of our state is a source of optimism. As a powerful lever in promoting a healthy society able to use the engineering of its human resources to make a maximum profit from the advancement of science. I remain convinced that the conclusion of this meeting will contribute to the greater use of technological innovation and the achievement of universal health coverage. Thank you for your attention.